My name is Vicky Ho, and I'm a professor from the University of Montreal. I'm also one of the scientific directors of the Quebec Cartesian study. I'm very happy to have the opportunity to share with you some of my work. Today, I'll be presenting on occupational exposures to endocrine disrupting chemicals and cancer risk. So let's jump right in. So what are endocrine disrupting chemicals, or I'm going to refer to them as EDCs throughout this talk. So they're a group of chemicals that can alter the proper functioning of our endocrine system, which includes the production as well as the regulation of hormones. And consequently, this disruption can cause adverse health effects such as cancer. Now, we're all exposed to EDCs in our daily life. This could be via food, our environment, the use of certain personal care products. And given this widespread exposures, EDCs are actually really hard to study. But exposures in certain workplaces occur at much higher levels, and that's why my team focuses on the occupational environment, because it gives us this wide contrast between those who are highly exposed in certain jobs versus those who are just exposed via their daily living. So we focused on EDCs and their ability to disrupt hormones because hormones, and particularly sex hormones like estrogens or testosterone, can play a role in the development and the progression of many cancers. My team focuses on three types of cancer: breast and prostate, which are the most common cancers amongst Canadian women and men, accounting for almost a quarter of all cancer cases. As well, we also focus on colorectal cancers, as over certain age ranges, women actually have a lower risk of developing colorectal cancer than men, and these age ranges appear synonymous or maps well onto the timing of the menopause transition. So our study was funded by the Canadian Institutes of Health Research to investigate whether those who are exposed to EDCs at their workplace were at a higher risk of developing breast, prostate, and colorectal cancer. The main hypothesis was that exposure to EDCs at high doses, like those in certain work environments, can disrupt sex hormone levels and thus contribute to cancer risk. And this association may be different between men and women, and we were particularly interested in exploring sex differences in the etiology of colorectal cancers. So to do this, we selected participants from 4 regional cohorts in CanPath that had at least 30 new cases of cancers developing. These included participants from the BC Generations Project, Alberta's Tomorrow's Project, Ontario Health Study, and Quebec's Cartesian. So as you may recall, data collection in CanPath consisted of you coming into an assessment center for physical measurements, as well as completing this baseline questionnaire. For occupational data, currently all of CanPath have self-reported their current job as well as their longest held job. And since cancer is a chronic disease that takes a long time to develop, we used information on participants' longest held job to estimate occupational exposures, since we thought that this maps on best to the development of cancers. And we identified new cases of cancers by linking your information to the provincial cancer registries. And we used a study design called a case cohort design, which essentially compares the occupational exposures amongst participants who develop cancers in CanPath to those without cancers at the onset of CanPath. So in CanPath, now that we have information on everybody's longest held job, we were tasked with how do we evaluate your occupational exposure. So I'm just going to briefly go over 2 main approaches. First, we could use an expert assessment approach where we have experts assign occupational exposures based on the information you gave us. This approach is generally considered to be the best approach in assigning occupational exposures from the past, but it is costly, and the data quality really does depend on how much information you gave us, as well as the expertise of the experts themselves. Another approach is to use what we call a job exposure matrix, or a GEM. And a GEM is essentially just a fixed set of rules to associate a list of possible exposures to a given job title or a given job. And one of its main advantages is that it's cheap and quick to apply. though its validity does depend on the type of gem you choose to use, and that everybody who has the same job title would be assigned the same level of exposure. In our CanPath analysis, we weighed these strengths and weaknesses and decided that the application of a gem was most pertinent. So we used a gem called the Canadian Job Exposure Matrix, or CanGem, to estimate occupational exposures to 17 EDCs that's listed here at the bottom of the slide. Using CanGem, we classified participants into unexposed, possibly exposed, or exposed to any of these 17 EDCs. We were also interested in whether exposures to certain EDCs that affect estrogen or androgens differently would have a different impact. So we also classified participants into unexposed, possibly exposed, exposed, according to the way each EDCs interacted with hormones. So in other words, they can be estrogenic, or they potentiate the effect of estrogens, or anti-estrogenic or anti-androgenic, where they antagonize or decrease the effect of estrogens and androgens. So here are the results to exposure to any of our 17 selected EDCs and breast cancer risk. I know it's a bit complicated, so I'm just going to take the time to walk you through the figure. First, there is the arrow pointing to the vertical line, which indicates no association between exposure to EDCs and breast cancer risk. Everything to the right of the line would indicate a higher risk. Everything to the left of the line would indicate a decreased risk. Results here are shown by cohort, but if we pool all the results together in CanPath, I'm going to direct your attention to the red box. So here, if I interpret this box for you, for all of the participants in CanPath, we see that participants that were possibly exposed to any of our 17 EDCs experienced a 16% increased risk of breast cancer. In other words, that little diamond is to the right of the line, indicating a higher risk. While on the bottom graph, we see no association. In other words, women that were exposed to any of the 17 EDCs had no increase in breast cancer risk, and this is because the diamond touched that vertical line of no association. I'll walk you through another set of results, just shown another way, again, for breast cancer. Here I'm showing the odds ratio, which is just a statistic that's used to quantify the association between being exposed to EDCs and breast cancer risk. When I compare participants that were possibly exposed or exposed to any of the 17 EDCs against people who were unexposed. So this table shows you the same results as I shown previously for any exposure to the 17 EDCs, as well as those by different modes of action. So to interpret these estimates, anything greater than 1 would indicate a higher risk of breast cancer. So again, drawing your attention to this red box, what we see is a consistent increase in breast cancer risk amongst those who are possibly exposed to EDCs, and this is independent on how they affect sex hormone action. It seems to increase breast cancer risk regardless. Now, if I move on to our results for prostate cancer, the interpretation of these graphs are the same as before as for breast cancer. Again, if I draw your attention to the red box, what we're seeing here is those who are possibly or exposed to any of our 17 EDCs were not associated with prostate cancer risk compared to those never exposed, because again, these diamonds are crossing my vertical line. Same results shown in the table for any of the 17 EDCs and prostate cancer risk, but I do want to draw your attention to the red box, where what we're seeing here is an increase in prostate cancer risk among those who are possibly or exposed to EDCs that potentiate the effect of estrogen when we compare it to those who are never exposed to estrogenic EDCs. I'm going to conclude with our results for colorectal cancer, and here I'm just showing in this first set of table all men and women data combined. And what we're seeing here is no association between exposure to any of our 17 EDCs and colorectal cancer risk, although the risk estimates are close to 1. However, if we look at people that are exposed to EDCs that antagonize the effect of estrogens, we see an increase in colorectal cancer risk. As I said, I was interested in whether the associations were different in men versus women. So here I'm showing you the results by sex. Across the board for women, we actually see no association between exposure to EDCs and colorectal cancer risk, while a very different story emerges for men, those who are exposed to any of our EDCs or EDCs that antagonize the effect of estrogens and androgens were at a higher risk of developing colorectal cancers. So in the interest of time today, I only showed you grouped results. I didn't show you the results by individual EDCs. And here I'm just highlighting very quickly in blue for the EDCs that were common to both breast and prostate cancers, whereas the EDCs highlighted in pink were the EDCs that were only associated with increased breast cancer risk. In green was increased prostate cancer risk. The associations with colorectal cancers behaved a little bit differently. Arsenic and another agent called polychlorinated biphenyls were associated with colorectal cancer risk in both men and women, while lead and mercury was specific to men only, and trichloroethylene were specific to women only. So I will conclude with a few important considerations when I interpret the findings that we see in CanPath. First, overall, the prevalence of exposure to EDCs were actually fairly low across the CanPath cohorts, which limited our statistical power to estimate some of our associations. And second, I think I've already alluded to this a little bit. There is a degree of misclassification that's to be expected when we use a tool like a GEM. People that hold the same job title are assigned the same level of exposure, even though they may be exposed to different degrees, and we're not able to capture this with a GEM. And third, we did see differences across cohorts. In other words, sometimes what we saw in Quebec wasn't necessarily what we saw in Alberta, and we don't have an explanation as to why we see this. But just to sum up, overall, we see evidence that exposure to EDCs in workplace contribute to the etiology of breast, prostate, and colorectal cancers. And a potential biologic explanation is their ability to disrupt sex hormone levels. We are continuing our analysis for lung cancer now, and we hope to be able to share our findings with you in the future. So before I pass it off to Rachel and Jen, I would just like to thank you for your participation as well as your ongoing commitment to CanPath. Thank you.